So the student council and I have put together a series of meeting times that are going to be a bunch of different things. The main thing, the focus, the topic, it's like this. So first, it's always good in the very beginning, you want to outline, like, what are we doing? What are you going to talk about? What is this? Okay, this is like a lecture, seminar, lab series on what is called 叠打就. Maybe you have never encountered these terms before, okay? Maybe you've never encountered the terms, but I bet if you're a Chinese medicine student or you're peripheral to traditional Chinese arts and sciences, like maybe you are also peripherally aware of like Chinese martial tradition and physical culture, Chinese style like orthopedic, health, wellness, maintenance. You probably already know about this, but you don't know that you know about this. Okay, if you've ever experienced zhenggu shui or evil bone water or any liniment, okay, what I'm going to be talking about is my experience, which is considerable, with the use, creation, prescription of, creation of liniments, okay? Liniments. So, 跌打jiu means hit, and fall, whine. So this is, what we're going to be talking about is liniments that are macerated and extracted in alcohol that contain Chinese medical herbal products. And we know herbs is just a bunch of different substances, because actually, if any of you are so inclined, I will counsel you in a way to help you add a whole variety of different products to your liniments that are used for trauma. Trauma, yeah, like physical trauma. Like you fell, you got hit by something, you were bruised, you were injured, you broke a bone, you have like an old scar that's tight and painful, and we're using these external applications in conjunction with forms of treatment like self-massage, gua sha, even movement itself. So some dietdajiu you put on prior to doing your exercise, and then your exercise actually activates them and helps to heal your body. That's going to be the topic, is the dietdajiu. So this is the Mandarin. And today we're mostly just going to be talking about history, context, kind of like what are we going to be getting ourselves into, right? What are we going to be talking about? Because it's going to be over 3, maybe 4, right, Maria? 3, maybe 4, okay? So today is just talking, and today is introducing. And hopefully it's like, again, hopefully this is something as Chinese medicine students you all have some experience with already. Maybe you've used zhenggu shui, maybe you prescribed zhenggu shui or evil bone water. But it's actually a whole tradition. It's a whole tradition of the creation and use of these liniments, these external medical products. Okay, so today's like history, context. What am I talking about? What are we talking about? What are we going to do? Okay? What are we going to do? Today is talking about it. So today has a strong lecture component. I'm going to break it down because what I got all the time was I got students who would ask me and wanted to know about this, not just because I'm a Chinese medicine teacher and practitioner, but also because my background specifically, like who am I talking about this? My background related to this is I'm actually, sure, if you want to. who am I while I talk about this? Why am I talking about this? Part of my training, not only as Chinese medicine practitioner, licensed acupuncturist, Chinese medicine teacher, a substantial portion of my training and experience comes out of traditional Chinese martial arts. So what's called 传统武术, traditional Chinese martial arts. Traditional Chinese martial arts. So in the school that I was raised in and in the lineage that I'm a part of, and now part of what I teach also as a, we'll just shorten this to say Gong Fu, as a Gong Fu person, I've used extensively liniments in my own practice. I use liniments extensively in my own practice. I've made liniments for years and years and years now. And I have actual recipes that I inherited from my teacher, my teacher's teacher's great-grand teacher, ancient lineage recipes of liniments that can be used in a bunch of different ways. So when I talk about this subject, my Chinese medicine students often get excited and say, share with me, share with us, teach us, because actually is very, very effective when applied medically, not just in the context of traditional Chinese martial arts, but also maybe you did some really intense gua sha, and there were a lot of sha came out. Well, what I would do in my private practice, I'd make my own liniment, I apply the liniment, and literally, sometimes just in hours, the sha, you can actually see it start to move like a cloud on the person's body, and the bruise goes away, and there's no pain, and it speeds up the healing and also enhances the therapeutic effect. That these application of liniment, especially for external medicine, so like orthopedics, external medical stuff, really it's supposed to go with, and the Chinese medicine practitioner would know and would probably be making their own liniments. So because I received this kind of interest from the students want to learn more, I'm like, well, actually, and because you all are, it's not just something I'm teaching for like the general public, not just like anybody can do, because actually anybody should not do. You need diagnosis. You need the correct application. There's a variety of different kinds of liniments we can make. We can make cold liniments, we can make hot liniments. We can make very mild liniments, it's more for qi stagnation. We can make stronger liniments, more for blood stasis. We can make liniments that are analgesic. We can make liniments that are like the whole rainbow of the Chinese pharmacopoeia, actually we can use to make our liniments. You can make liniments that are more like perfumes, some of them. Some of the liniments I like to wear, I'll just like dab on my shoulder and my neck because it's good to relieve qi stagnation, and who doesn't get a little qi stagnation up and around here. Also protects my channels, also has a nice smell. Maybe I put like, you know, rogue and a little huoxiang and a little bit of dingxiang and a little bit, and so then the smell is this nice. So all I'm saying is you could take this knowledge that I'm going to disseminate and the skill of how to make the liniment, you could apply it in a bunch of different directions, and at the same time, as a Chinese medicine practitioner, you really need to be empowered with some specific knowledge about how to do this. So some of the recipes that I might talk about, and especially the more like the stronger ones, like the ones that I like to use, they actually end up being very, very toxic. Toxic if you ingested them. None of this will be for internal. This will all be for external. Applied to the skin, totally safe, okay? Applied to the skin, totally safe. Not for drinking internally. That's a different kind of medicinal wine, which may be like next term or something. I also have some information experience making internal medicinal wines. But this is, have to keep totally separate. So even to the point that like many of the formulas I would suggest, if you apply them, they're on your hands, they're on your body. You do not let your dog lick. You do not forget that you put on your hands and then do something like prepare food for a small child. You would need to make sure. So that's why it's kind of like, if I kept it in the realm where it was like totally safe, consumable for everyone, actually it wouldn't be very effective. A lot of the stronger, more effective liniments, they do have an element of toxicity. So I think this level of knowledge really lives with Chinese medicine practitioners, because they will respect the power of the formula and they will understand and know time to use, time not to use. When you use, here's how you use. If you use this way, you get good results. Do not use this way, okay? So I'm going to teach you all about Diet Jiu. I'm going to teach you different ways to diagnose conditions from your patients, when it's appropriate, what kind of conditions. I'm going to help you formulate. I'm going to give you base formulas that you could adapt for yourself. I'm going to give you about 5 different base formulas depending on what you want to make. We will actually, by the 3rd or 4th meeting, go into the herb room, collect the herbs. We will bring supplies and I will teach you how to mix. And they actually need to ferment also for a period of time. Not really ferment because it's in alcohol. There's not a lot of microbial activity. Extract is a better term. Needs to extract and macerate. Okay, so that's the broad overview. Okay, so this is the Mandarin. Anyway, so for me, it comes out of traditional Chinese martial arts and Gong Fu. That's like for me, I have a lineage. Specifically, this information comes from, if you want to do your own research, I'm like a great grand student of somebody that was really famous in specifically this world of using liniments, whose name was Guru Zhang. Okay, Guru Zhang was super famous for his iron palm skill. That's a whole other discussion, because many people don't know that iron palm as a practice is appropriate not only for martial artists, but is routinely taught to massage therapists as well. Because iron palm will actually reverse any arthritis you have in your hands and prevent the arthritis from happening in your hands, and will change the structure of the tendons and bones in your hands. If you practice at the low level and you practice like maybe you do a lot of like massage and oh, my thumb, my wrist, my hand is hurting me. Well, in Chinese medicine, you would always teach the massage person the first level, like level 1 of iron palm, so that wouldn't happen to them. Level 2 and level 3, that's for like if you really want to turn your hands into weapons. Level 1 is actually everyone can do, is not going to deform your hands or hurt your hands in some ways, actually strengthen. Think about open the channel. Open the channels in your hands, okay? So if there's interest in that, I can also teach that. It's not hard to teach, but you do have to have a teacher that can teach it, and that could be a thing that we would learn after this. I'm giving you this context so you know the specific place that I'm coming from. So I practiced that for a long time. I practiced many years iron palm, made all the liniments. My teacher, who received from his teacher, I got the teaching from Guru Zhang. His grand student was somebody named Quang Wing Lam. Quang Wing Lam. And he was my teacher's teacher, so he's my grand teacher. Ted Mancuso is the person who taught me. Okay, so that's my lineage chart. That's where I come from. And then you would draw a little arrow here, and you would put Nick Hancock right there, and then there'd be another little arrow, and it would go your name here, okay? But it's coming out of iron palm tradition. Body conditioning. So really, iron palm is a form of Qigong. That's how we should understand. It's a form of Qigong. And it's related to body conditioning in the martial arts tradition. There's a lot of different body conditioning systems. There's iron palm, there's iron jacket, there's iron shirt, there's iron head, there's iron crotch, there's a whole comprehensive, systematic approach to conditioning the body to do what? To open the channels using stimulation from the outside, so repetitive percussive force, and then soaking the hands and applying herbs over the hands to physiologically and energetically change and transform the hands. Totally safe. Again, totally safe. Practice at the most basic level. Anybody could do. Any condition also could do. Will be good. Will relieve pain in the hands. Will make your hands much stronger, actually, in a weird way, because it does something to the way your tendons attach to your bones. And then like the mechanical forces all change in the way your hands function. So then it would, of course, it would be good for massage also. Massage therapists and also martial artists and also anybody that's interested in health and wellness. Actually, I think that we could position iron palm as a health practice also, even though its name is sort of like, turn your palms into iron. Just think of it as a body conditioning Qigong style, okay? So that's where I'm coming from. That's where all of my formulas I received, and then I did my own research because I'm a TCM practitioner, and then I tweaked it, and then I experimented with it, and then I created my own, and I applied them, and I kept tweaking them and applying them. So it's also an art form. That's like, this is something that I want you to think about, is that this is also an art form, that making your own liniments, you can, when you receive this information and then you take it and you start experimenting with it, you also, especially as Chinese medicine professionals, you're empowered to take this in whatever direction you want. Again, as long as you understand and you receive, you know what is safe, you know what is not safe. I will make that all clear. In fact, I will come back around to that over and over. Question? Any question yet? Clear? Good? Anything before I move on to like, first I'm talking about what we're talking about. Now I'm talking about myself talking about it, why I can talk about it, and where I'm going to come from. The next thing is we'll go back out to like, we're going to look at diet, da, jiu, and talk about, that's the Mandarin. Dit, da, jiao is the Cantonese. Maybe my tones are not perfect, but it's actually a huge tradition. Correct. We'll get there when we get there, but generally speaking, correct. There will be whole sets of like, if it's like for example, the hot formulas I give you, I will not want you to use on something that is swollen, red, and maybe infected. The cold formulas I give you, I will not want you to use on like things that are cold to the touch, dull in their pain quality, and chronic. That there will be a whole, actually I'm going to feed this into your network of understanding as TCM practitioners so that you, if you really wanted to get into this, maybe you would like this, you wanted to create your own products or whatever, you could make like a hot one for this, a warm one for that, a cool one for this, a cold one for that. And then each one would have its own specific set of use here, not here, use there, not there, use here, not. So this also is feed with your diagnosis. It's all consistent. Yeah, it's fun. I think it's fun. And then we also get to craft. We get to make something, you know, like we get to experience that. Depends on how much you want to make. I always have to make a bunch for myself, and I'm overdue in not making any. So I'm also using this opportunity. Like I need to make about 3 gallons for myself. And I was telling my students, I need to make like 3 gallons for myself. And they're like, can we make some with you? And then I'm like, let's just do a lecture series and a seminar. Because it's here that I'll get my herbs. Okay. Yeah, not on broken skin typically. Yeah, broken skin would be something else, like usually dry powder or some kind of medicated salve. Yunnan Baiyao is good on all kinds of like wounds. But anyway, external medicine is a huge topic. You're going to learn about that later. It's its own huge topic about when you apply what to what and what kind of result you should expect. Okay, so no other questions. So Diet Da is its own. This is basically the way of talking about Chinese medical traumatology. When you say Diet Da, that kind of means traumatology. Hit and fall, bruises, injuries, external, okay? And then we put the Jiu, that means some kind of alcohol-based liniment, okay? There's different kinds of alcohol you can use, just like there's different kinds of herbs you can use. I like to make mine with gin. Why? Juniper is a wind damp herb. So juniper already has the qualities of like relieving pain, opening the channel. This was recommended to me. There's some resources. So Tooth from the Tiger's Mouth by an author named Tom Biggio. That's a really great reference on this topic, Tooth from the Tiger's Mouth. He's got his own recipes in there from his martial arts lineage. He'll talk a lot about also. So maybe we have it in the library, but if you're interested, I think it belongs in every Chinese medicine practitioner's library, this book. And it was from Tom Biggio that I got the idea to use gin, because juniper works that way. Traditionally, though, you might use like something a little stronger than Baijiu, so something stronger than like rice liquor. Like, I think vodka, if you don't like gin, you can do vodka. Some people do vodka because like 70, something between like, I don't know, 30 to 50 or 60% alcohol is the best. More than that is not good. Why? Because actually when we do the maceration, so you need the water content and you need the alcohol content. So that's part of what makes the Jiu special, is you have a water content and you have alcohol content. So it shouldn't be like 90% alcohol. No. It needs to be something between like 30 to about, the upper limit I would say would be, I think even 70 is too strong, 30 to 60%. So like 60 proof to 120 proof, not pure alcohol, because water and alcohol have different solubility rules. And that means we're going to get a much broader extraction from the herbs, right? Because we know that alcohol can pull things that are fat soluble, and water's not going to pull those things. So we add that to our herbs, and we need to let it sit for, it needs to sit for at least 1 month. Sit for 1 month. 1 month later. You need to shake it too. It's good to like shake it every day, like turn it upside down and then put it back in a dark place and then come back and do that every day.
The longer the better.
Yes, yes. So sometimes what I'll do, it's a little like kombucha, even though, again, I know kombucha's fermented, this is not fermented, but I'll start a jug, like a gallon. I'll start like a gallon, and then after a month, I'll start decanting off that gallon, but I'll just refill it with alcohol and refill it with alcohol. And then about a year or two later, I'm looking at it and going, yeah, it's getting a little thin, new batch. And so then what I do is I decant all the alcohol off. I take those herbs, I like grind them up, or like I mash them up again, and I add them to my new formula. So it's like you're just like keeping this steeping richness of herbal liniment juice. It smells really good. One of the things that you're supposed to know, like my Gong Fu teacher always says, is when you go into the Gong Fu school, you should instantly smell the smell of the liniment that the teacher is making. And if you've been to enough good Gong Fu schools, you will know based on the smell of the liniment, is this a good school or not? It said this should have a certain kind of a smell. And you'll know, oh, so making dittajio in here. Oh, and it's good. Oh, it's an interesting sifu. Oh. So there's a whole rich tradition. So you let it sit for a month and you kind of shake it up. And you shake it up every day. And then you keep it. And then I would say like a year, 2 years, depending on how much you're using it. Maybe you even make one jar that I did that one time. I had a whole gallon that I'd forgotten I made, and then I pulled it out like 10 years later. It was like the best stuff ever. Because it's not going to expire. It's just alcohol based. Use it after you gua sha. You can use it after you cup. Cupping is a little bit, I don't know if I would use it. The really toxic ones I wouldn't use on cupping, because cupping with the suction tends to open up the pores and draw everything to the surface, so you have increased, but for sure for gua sha, for sure for any kind of bruising, trauma, pain. Also, there's a special formula I'm going to share with you that I adapted myself that I've used to treat things like ganglion cysts and also like arthritic accumulations in joints. So like maybe you had a joint injury and then that joint was just not the same. Here's really, let's talk about that. How does the channel pathology happen? There's different ways, right? One side can be from the inside. So maybe the channel pathology happens because of the diet, the lifestyle. Going back to diagnosis, what is the internal sources of disease versus external sources of disease? Channel pathology can happen from the internal source. If the channel pathology happens from the internal source, you can use external medicine to treat, but really should be internal medicine to treat. If a cause from diet, lifestyle, then really diet, lifestyle, herbs, you need to use internal to fix. You can use external, but if you're only using external sources internal, it won't really resolve. It'll just be like a palliative care. However, if somebody falls and hurts their knee, somebody falls and hurts their whatever. Question?
Is that 5 and 6, internal and external?
Oh,
5 6 Fu and then 5.
in the internal, there's an internal and external.
Okay.
Because a fu is an organ, but among the organs, it is the yang organ.
Okay. So then it's like
12. 12 is based on 6. But now I'm talking 12 channel.
But that's external.
External, very close to the surface of the external.
So 6
6 become 12. Somebody falls and somebody hurts their elbow, okay? And the way that they hurt their elbow, it damaged the tissue, damaged the channel, and at the same time, something from the outside environment got in. Not necessarily like an infection, not like but just like when they fell, it was on a cold day. Then they didn't go directly home. They kind of just went like, ugh, and they're like, ouch. Then they're like, well, I'm on my way to go see a movie. And then they're like, shake it off. And then they go and they sit and they watch a movie. And they're like, okay, go home. And then they're like, ooh, my elbow still hurt. Then they go home. They're like, oh, I'm going to do something. I need to take a bath. Then they feel a little better. But there's just some dull, deep ache in that elbow. Dittajio is like what should be used to treat that kind of problem, along with gua sha, needling, massage, to treat the outside part, right? So the whole variety of external issues, like I mentioned, ganglion cyst. Well, in like Western medicine, their treatment for the ganglion cyst will be either like surgically, we need to remove that, but then often they grow back. Or they'll drain it, they'll aspirate it, they'll like lance it and then squeeze the synovial fluid out and then say, okay, and then it'll come back. This kind of external treatment can actually shrink it, make it disappear and never come back. So the therapeutic principle, like underlying, so you can use it for ganglion cysts, you can use it for pain, you can use it for arthritis. I've used it, like I had one of my patients was a flamenco dancer because I'm deeply involved in the traditional Andalusian Gitano flamenco community as well. So I treat a lot of flamenco dancers, or I did in private practice, and they had all kinds of foot problems. They had all kinds of foot problems and toe injuries and ankle injuries and knee injuries, and these people loved Ditagio. And they would see me just for me to apply my liniments that I made like proprietarily, because it was so good to relieve their pain, to reduce the swelling from their repetitive injuries from striking on their feet. So all kinds of our different arthritis, any kind of channel pathology that is accumulated. So when you learn about external, like, okay, any students who had the diagnosis with me, there's two types of the external disease. You didn't have it, so you're free from answering this. I'm pointing at the ones in the back. Two types of external disease. What are the two types of external disease?
There's a bigger category and a smaller category.
Correct.
It's like
Oh, sorry.
I would say theater, I think.
At 1 o'clock.
You have the smaller one is like the B. Isn't the smaller one?
Correct.
The bigger one is like exterior invasion.
Correct. External disease. There are two types. One is the chronic channel pathology, which gets summarized as B syndromes. And the other one is acute exterior wind invasions. Acute exterior invasion. And so that one, the Chinese medical is your yin-wei disharmonies. Okay, yin-wei disharmony. So this Ditagio can be applied to this entire category. That entire category, okay? That's what I wanted to make clear. Because it applies to that entire category, the treatment principle will always be you are moving qi and blood in the channel. Moving qi and blood in the channel, all of the formulas will be like 75% focused on that. And then we'll also have a whole other variety of treatment principles, from like dissolving and dispelling phlegm, clearing heat, drying damp, cooling blood, warming yang, everything else in there. But the number one thing you want to think is moving qi and blood in the channel. Okay, so next time when we meet, I think it's on Thursday. Next one is on Thursday, same time. Then I'm going to get more into the specific types of formulas. I'm going to share with you different formulations. I'm going to talk with you about the diagnosis. I'm going to talk with you more about the cautions, contraindications, and applications. More specific detail. Then our third meeting, we're starting to get ready to make them. And then I'm thinking for the fourth meeting, I will demo and lab for you how to apply them.
Cool.
Woohoo!
Cool.
Was it?
Yeah, it's great.
Something you had heard about but didn't know a lot about.
Yeah. I want to learn more about herbal.
Okay. It's really good. It's really good. It's really good. It's really good. Thank you, my dear. because I just rolled right into everything. Maria will take. She'll be right back. Let her touch her camera. I know you could. No, I know. Sorry to infringe on your space as you prepare. We're exiting. I was giving a lunchtime lecture on dietagio, liniment,
Oh, nice.
liniments, how to make liniments, how to apply liniments, what liniments are, yeah, because I know a lot about that.